Oh, welcome back. I hope you have a good lunch. If not, then we have we have another dinner tonight. You can join us for dinner. Now we are starting the second section, which is the public health crisis, and you will be moderated by Dr. Stephen Wong. Dr. Stephen Wong is the head of the Chief Executive Policy Unit, the Hong Kong government. May I introduce Stephen first? Okay, Stephen, we have been Stephen and I have been knowing for each other. We have been working in our Hong Kong Foundation. Now he is the head of the chief. The most important thing of the Hong Kong government is the CPU of the Hong Kong government. And now today's section is about public policy. So we definitely we would like to collect real opinion about the policy, and then hope that our ideas can be reflected back to the government. So I give the time to Professor Stephen Wong.
Yeah, honored to be here. My job is a little bit about myself before I introduce the speakers and the panelists. My job is basically the internal researcher for the chief executive. So therefore, I'm here to learn. I'm open to all ideas, and feel free to criticize the government policies because I would take this as I would take that constructively as we are preparing our internal research because all these constructive suggestions will be the basis for further improvement because our CEO has always said 沒有最好，只有更好. It's not the best, but always we can strive to be better. So without further ado, I'm so glad to be here to learn, and I wanted to introduce our speaker. And everyone already know Dr. Thomas Tsang very well. He is the public health specialist, worked in the Department of Health during the period of 92 to 2012. He became the controller of the Center for Health Protection between 2007 to 12, and president of Hong Kong College of Community Medicine. And currently he's a member of the Hospital Authority Board and chairman of the Hospital Governing Committee of Queen Elizabeth Hospital. So he's obviously very experienced in handling a lot of public health crisis. So without further ado, Dr. Zheng.
Thank you very much, Stephen and Anthony. Good afternoon, everyone. I'm really so privileged to be here today among this group of very distinguished researchers and scientists. So maybe let me make it clear, first of all, that this is not really a lecture in the traditional sense. Okay, I won't talk about theories or a lecture about the right things to do in a public health crisis, which is the topic today. Instead, in the next 20 minutes, I'm going to bring up some key issues that we face in a public health crisis and how they relate to a sustainable healthcare system. I hope they will provide good bullet points for discussion in the panel session, which is definitely more important. So please excuse me for keeping my slides deliberately sketchy. Okay, so if we go to Amazon, you'll find many textbooks and journals have been written on the subject of public health crisis. And we also find plenty of guidelines from the World Health Organization, the US CDC, and many other overseas authorities on the same subject. And in Hong Kong, the SAR government and the hospital authority have various contingency plans on infectious diseases and other kinds of health crises. Now, some people consider public health crisis should include things like obesity, cancer, cardiovascular diseases, climate change, etc. And I agree with them. Okay, but in this talk, we'll focus on the more acute type of health crisis that may leave a more protracted effect on the healthcare system, as typified by the COVID-19 pandemic. We'll look at two questions. First of all, how may we leverage on the public health crisis to enhance healthcare system sustainability? And second, how can we do better in managing the public health crisis? Now, the negative effect of a health crisis on the healthcare system is very clear. Most visibly, health crisis disrupts healthcare services delivery. During the fifth wave of COVID last year, the hospital authority had to cut half of non-emergency services. Health crises also divert and drain resources. For example, government had to give HA several $billion extra to fight COVID. And the health crisis also shift policymakers' focus away from other health priorities. I very much sympathize with Professor Sophia Chen, the former Secretary for Food and Health, who probably had to spend most of her time dealing with COVID issues alone. And there are numerous other knock-on effects. If you are a doctor or a nurse working in a medical ward, you know you work less efficiently if you need to gown and degown a dozen times a day. And also your stress level goes up for fear of getting infected. Now, according to a survey by the World Health Organization, the COVID pandemic disrupted treatment services worldwide, not just in Hong Kong, of course. And this happens not only for chronic diseases like hypertension or diabetes, but also for more urgent conditions like cancer and cardiovascular emergencies. And besides treatment services, many countries also reported disrupted rehabilitation and screening programs. Nonetheless, a public health crisis may catalyze positive changes to the healthcare system. First of all, the community is more health conscious, wearing masks and all that. And indeed, we see many infections like the seasonal flu almost disappearing, reducing the demand for health services. The health crisis breaks down institutional barriers. For example, it forces all government departments to come together and share responsibilities for the health sector. I would never have guessed that the Civil Service Bureau would take the lead in the government's COVID-19 vaccination program. Health and hospital infrastructure and also get a big boost thanks to the health crisis. Just look at all the new isolation facilities, quarantine facilities that were set up during during COVID-19. And last but not least, a health crisis facilitates the development and adoption of novel tools, models, and operations. And we see lots of these examples during COVID-19. The expanded use of telemedicine and the delivery of antiviral drugs at your doorstep are good examples. For the first time, the private sector and the NGOs run community vaccination centers alongside with government. For the first time, community treatment centers and vaccination centers were set up in non-health facilities. For example, in Asia World Expo and in many government sports centers. For the first time, a long list of new laws were put up in a short time, like mask mandates and restrictions on gathering. And of course, we cannot go out to eat without the mobile app, Wan Sam Chue Hang, leave home safe. And all these are unprecedented changes. Now, how might these changes affect the sustainability of the healthcare system? Well, they certainly help us get better prepared for the next pandemic or the next public health crisis. With upgraded infection control measures, facilities, and staff, we may see fewer hospital-acquired infections in the future. Some modes of healthcare delivery, like telemedicine or doorstep drug dispensing, as I call it, may add efficiency to clinical consultations and clearly shorten waiting times. The expanded scope of public-private partnerships, like cataract surgery, and medical social collaborations, like better support to elderly homes, will help relieve the heavy burden on public hospitals. If a significant part of the public manage to sustain their health-promoting behavior or healthier lifestyles well after the pandemic, that would be good news to chronic diseases as well. So all these bode well for healthcare system sustainability. Now, what can we do to sustain these positive changes? Here are just a few points, and there should be more. First, the proper evaluation of benefits will help convince decision makers and ourselves that we are on the right track. We should keep deploying beneficial structures and interfaces created during the health crisis and not let it rust. And better still, we could assimilate these new changes in our routine operations or reconfigure them for other new purposes. And of course, we should appropriate resources to maintain those changes that were shown to improve healthcare system sustainability. Now, let me move on to the second question. How can we do better in managing a public health crisis? Well, as I said earlier, there is a mountain of literature on this. What I list here are some common recurring themes. You also find them in the SARS Expert Committee report back in 2003. So you may think, well, handling a health crisis is easy. We just follow these rules and principles stated in the books. Well, but it turns out life is not that easy. Even if the goal is clear, the path to it is often full of tough hurdles. And I'm going to mention a few tough hurdles, a common few obstacles, and I hope we find ways to hop over them in the panel session. Now, I've shown you lots of preparedness and response plans, including those by Hong Kong. The trouble is, every time a new health crisis comes along, there's bound to be unexpected issues and situations that the plan hasn't got. The truth is, it's impossible to list and prepare for all possible scenarios. And sometimes we may be forced to make changes outside or even contrary to what the plan has stated. And this has happened before with activation response levels. Frequent changes are also a problem. During COVID-19, there are times when case definitions, admission and discharge criteria, isolation and quarantine durations, all these change literally by the day, and healthcare staff had a hard time coping. Now, in decision-making, we always talk about evidence-based decision-making, don't we? In a real-life health crisis, like a newly discovered virus, often the information is incomplete for that to happen. If you ask the experts, they may well come up with very different, even contradictory opinions. Sometimes, when there is scientific evidence for a particular intervention, it is hard to act on it due to opposite public perceptions. Two good examples are COVID-19 vaccine safety and the concept of mixed immunity. And sometimes even the goal is not clear. Do we just consider scientific health evidence or wider political socioeconomic perspectives? Or should Hong Kong abandon the so-called dynamic zero policy while the mainland is still sticking with it? Command. Command is all important in fighting a health crisis. Command structures are clearly laid out in our preparedness and response plans, listing who's calling the shots under each response level. But nonetheless, in a complex health crisis involving the whole of government and in society, there's bound to be things that fall in between the delineated roles and responsibilities. There are gray areas that no one claims to have authority to oversee, and this frequently causes delay in response. Also, we like to set up multiple platforms with steering committees, working groups, task forces, etc. And during SARS, I found myself mired in endless meetings with overlapping functions, leaving little room to do real work in outbreak investigations. I can bet you that coordination problems happen every time in a large public health crisis. Typically, bottlenecks occur when the work of different institutions intersect to undertake a new task. For example, in COVID-19, we saw significant bottlenecks moving patients across homes, hospitals, holding centers, Penny Bay, etc. And patients had to wait for long hours, even days, to get picked up. And the situation gets worse when a huge volume of repetitive tasks is processed manually. Think of all those thousands of quarantine and isolation orders that is issued every day. Addressing public inquiries is another common but seemingly unsolvable challenge in coordination. Although government and hospital authorities set up hotlines during COVID, people often complained they didn't help because, one, they didn't get through, and two, the hotline staff only know stuff of her own department and could not coordinate a reply that spanned across different departments, which is often needed. And finally, a lot of coordination is required to support vulnerable groups and institutions like elderly homes, and they tend to suffer the most when coordination fails. In communication, we strive for consistency, clarity, and the adequacy of the message. As a health spokesperson, your nightmare comes when medical experts say different things as you do, when you're unable to articulate what dynamic zero really means, when you're asked to explain policy decisions outside the health domain, and worst, when your unintended remark caused panicky people to scramble for masked medicines and daily necessities. Now you begin to appreciate how extraordinary Zheng did every day at 4:30. Rumors spread faster than viruses, and rumor control demand lightning fast response, which is sometimes not attainable due to lack of information. A competent and designated spokesperson makes all the difference, of course. They can be trained, no doubt, but you need to be lucky to have someone as good as Zheng. And sometimes, despite all our tricks and efforts, our communication fails to address the public concern. Many older people wouldn't get the COVID vaccine before paying a hefty price during the 5th wave of the epidemic last year that killed thousands of them. SARS and COVID-19 taught us an important lesson, that surveillance and information systems should be integrated and possess real-time capabilities. We made some notable achievements, for instance, in integrating patient data between the Department of Health and the Hospital Authority, and to a certain extent, laboratory data as well. And that tremendously increased efficiency in tracking patients and their status. But still, some other systems remain outside the loop, like animal surveillance. Universities, in particular, have called for a more open data platform to share real-time data for research and monitoring purpose. Well, the sustainability of these new information systems created during the public health crisis is by no means guaranteed due to resource data privacy and other concerns. Now, regardless of how well we handled COVID-19, people are going to stick with these images in their minds. And the root cause has to do with surge capacity. I live in Hangfa-chun. The typhoon Sanjuk led me to believe that we're not going to beat Mother Nature as her most furious. It will overwhelm whatever surge capacity we think we have, like what COVID did to any country in the world. But still, expanding surge capacity is critical in mitigating adverse effects. Indeed, Hong Kong took exceptional and unprecedented measures to boost surge capacity during COVID-19. And this is by no means an exhaustive list, and I won't talk on each of them. But the interesting question really is, what is missing? Well, I don't have an answer, but here are some ideas we can further look at. First, could we predict the peak of the outbreak further ahead to allow more time for scenario planning and advanced preparations? Before the health crisis strikes, could we sign prior service agreements, train our partners, and prepare standard operating procedures for all of them so that they can all jump in full gear when we press the button? And also, once a health crisis is imminent, could we communicate with the public preemptively what we're going to do and how they'll be able to help in different stages of the coming crisis? Now, there are many other aspects in managing public health crises that I don't have time to cover. We certainly pick them up in the panel session, I believe. I just want to highlight the aftermath and recovery phase. Taking COVID-19 as an example, the healthcare system needs to find a good solution to manage an uncertain number of patients with long COVID and quickly clear the long backlog of non-emergency cases that the pandemic left us. All right, I should stop here, and I'm sure many of you have great ideas and great lessons and experiences to share. So thank you very much for attention.
Thanks, Dr. Tsang. Next, we will invite respondent, Dr. Daniel Chiu. He graduated from University of Hong Kong in '74. That's when I was born. He's a specialist in pediatrics and was afforded a fellowship from the Royal College of Pediatrics and Child Health in the United Kingdom. Over the years, he has developed an interest in primary care pediatrics, child health, preventive pediatrics, and vaccinations. He is currently a member of the Scientific Committee on Vaccine Preventable Diseases, Center for Health Protection, Department of Health in Hong Kong. So, Daniel.
Good afternoon, dear fellow colleagues and everyone. Thanks, Dr. Wong, for the kind introduction and allowing me to respond to Dr. Zheng's speech. As expected, Dr. Zheng has been always giving very inspiring talk, and that I cannot fully agree with you further on that. Every word you say that this is very informative and inspiring. You have given quite a lot of the real examples of how difficult public health can be, and that it's easier to be said than done. And that you have told us that quite a lot of the measures the government has taken in tackling all this. As Professor Kit said, I'm just looking at it from another perspective. It's the matter with primary doctors. It's what primary doctors matter. Okay, what matters to us is that as a primary doctor and or as a citizen, I like to have more and timely, appropriate, and evidence information. And this is very important. Well, as a citizen, you have to know what is the problem. And as a doctor, is even more important. We have to know that what is the crisis, what is the underlying cause, and what's the root cause, and how is it spread, and how all this information are very important for us, not only to say that treat our patient, but also to prevent ourselves from getting the disease and from our nurses quitting the job. So this is very important for us. Also, that it's important for us, say that to do all the planning and also to collaborate with the government to do all the prevention, education, and planning. But in the past few months, past 1 year, we have a little bit problem in getting the right information at the right time. Because as Dr. Zheng has said, there's more rumors than the virus coming around. And many a time, the different televisions have different specialists talking about different concepts, and probably sometimes at the two ends of the story. And some people might advocate the N95 for everyone, and one that they advocated only a simple surgical mask, and another one recommending a double mask. So the public and also even the doctors are at a loss at what we should do, and whether we still can enjoy our hot pot, or whether it's dangerous or not. Well, we get quite a lot of myths and also misconception and not evidence-based, and it's quite conflicting. So that as doctors, we like to have information evidence-based, fast, and timely. I think that the government has done quite a lot already. I know that because I am in the committee on the vaccine preventable disease, and we have been meeting every now and then, and we've been asked to read 100 pages of paper every time before the meeting. But I mean, for the general doctors and public, this can be a challenge, the information, and also all the political rumors. The second question we like to ask as a doctor is that what we can contribute to the society and what, and we can talk to our patient as far as information allows, and that we'll try how to protect them, and also to early detect the complication and all the problems, and early referral, and prevent those less severe cases going to say make the hospital infrastructure fail. And this is one of our job. I'll advise them that for the isolation, also the prevention in PPE, and this is our contribution. But I think that something can be done more. We participate also in the outstretched the program for vaccination. We have participated also in public education and talks. We have also participated in some of the visiting to the elderly homes. But anything more we can do is something that we like to do. And also that as a matter of research and data analysis, we are at the front line. We can probably provide more information in that area. So that without further ado, I'd like to just bring up a simple question. The communication, can it be better done? Or what can be better done? We have Chen Chukwan as a very hardworking lady, but is it the only way, or well, can we operate a little bit? Because the TV, the television people just like to select one or two sentences rather than the whole message from the government. Can something or can any other website can be done, especially for the elderly people who do not visit the website? I understand the DH website is very comprehensive, quite a lot of data. But for elderly people, they don't visit them. Okay, they only so-called open the computer with the hammer. Okay, they don't turn on the computer. And the second, I think that Dr. Zheng can advise us more how the human resources and also the say material resources can be contributed, can coordinate better. I think the Professor Lin can speak on his perspective that whether Chinese medical practitioners have been fully employed and utilized in the fighting this crisis, and also that as a primary doctor, I think that Dr. Wong that is very qualified to tell from his perspective, and this international collaboration is very important. Across the border collaboration also important. I also that the post-COVID management, as Dr. Tsang said, that whether the Chinese medicine, where also the originally scheduled, the normal scheduled operation and management, whether they can be done. Last but not least, I'd like to say that the doctors can contribute more in the data and surveillance. I think that Professor Zheng can lead us in these areas. I think that I will open the back of the discussion to Dr. Wong. Before that, I just like to say that some new and mortalities have come up. We have more Zoom meeting now, so that well, even if you get the number 8 hoisted, you still have to work at home. Okay, and we have no more the telemedicine. I think the government might be making policy or making recommendation, or also the guidelines on the telemedicine. And okay, last but not we cannot forget that the other public health crisis that include mental health diseases and also the environmental hazards that may bring along, together with the monkeypox might be still around. So I'll pass back to Dr. Wong.
Thanks, Dr. Chiu. May I invite the 3 discussants, and first we invite Professor Lin. Professor Lin is a PhD in pharmacognosy in King's College London. Next time I have to prepare this remark before I read it again. He is a qualified Chinese medicine practitioner and has many years of experience treating various internal diseases. And Professor Lin has a strong interest in randomized clinical trials in Chinese medicine. And he has published more than 200 articles in international peer-reviewed journals. Professor Lin.
Okay, thank you. Thank you. Dr. Wong's kind introduction, and also I need to really thank Professor Fong and also Dr. Fong's kind invitation. So for this, I thought today actually is a casual talk. Actually, when I come here, actually it's not quite because I think today is a good day because we also have a symposium and conference down the other side of the campus. Well, talk about the healthcare crisis. So I will ask, what crisis? Well, I think the crisis can only be arisen from, I think I can think of the 3 factors. One, of course, is about money and also the funding. I think Hong Kong certainly is not short of the funding from the government, also I think the industry. And the other thing, of course, if we don't have good technical know-how, then of course we may have a crisis for healthcare. And the third one, I think probably is we discussed a lot today is about the talents and about the human resources, that sort of a shortage in Hong Kong here. Because the general public know very well when they go to emergency or maybe the general specialist or general clinic, they need to wait a long time. So talk about several months. So the shortage of doctors, specialists, and nurses, and also other allied health probably is the point we need to discuss more in the future. So human resource shortage certainly is one of the biggest problem faced Hong Kong's medical and also healthcare system. Now, on the other hand, if we look at the healthcare models in Hong Kong, we can divide into two. One, of course, is Western so-called mainstream medicine. Another, of course, is Chinese medicine. So we have 10,000 Chinese medicine practitioners. Among them, we have more than 88,000 registered Chinese medicine practitioner. Basically, it's a full licensed Chinese medicine practitioner, also plus over 2,000 TCM listed TCM practitioner. So this is certainly a very strong force. I mean, the number, if you only compare the number, actually East and Chinese and Western medicine, more or less probably 1 to 1.3, that sort of a scale. So how to integrate these sort of Chinese medicine human resources into our healthcare system is certainly we need to discuss, and also I think the government need to hear to this sort of voice. Well, Chinese medicine, why Chinese medicine? Because in our culture, we have been practicing Chinese medicine for thousands of years. So Chinese medicine is, well, as general public we know, is very good at treating chronic diseases. This is one thing. The other, actually, Chinese medicine actually is very good at preventing diseases, as we in Chinese medicine we call it 鸡没病. Basically, when the disease is not quite occur yet, we treat and we try to prevent it. So Chinese medicine actually, we usually actually use herbal medicine acupuncture to moderate one's constitution and also increase one's immunity so that the disease is not quite easily happening. And so during the fifth wave pandemic in Hong Kong, we're talking about just only 1.5 years, about 1 and 3 months ago, 1 year and 3 months ago, Chinese medicine actually was forced to treat a lot of these sort of pandemic patients during the pandemic. And certainly we observed actually have a very good response from the public. So there is a crisis. There was a crisis for pandemic, but it turned out it's a good opportunity for Chinese medicine. So what is the solution for crisis? So I suppose when we discuss all these crises, we try to, the final aim is to try to find a good solution. So the solution, I would say, is try to properly utilize the human resources of Chinese medicine practitioners into the healthcare system. So that you can treat a certain proportion of the patients, so that these sort of patients won't go to the healthcare system, or the public healthcare system. These sort of patients actually don't need to go to emergency A&E department that often. Put it that way. I will also think the integration of Chinese medicine into the public health system, actually we create a very good model, basically is integrated medicine. I know the time is up. So the integrated medicine actually is what we strive for in the future for Hong Kong's healthcare system. I believe this is also the final solution for Hong Kong's healthcare crisis. Thank you.
Thank you. Wow, this is everyone topic is a big topic. You can have a whole session just talking about Chinese medicine, I think. But that's great. So let's move on to the second discussion. Let me just the file next. This is Dr. William Wong, the Clinical Associate Professor and Chairperson, Department of Family Medicine and Primary Care in the School of Clinical Medicine in the University of Hong Kong. He holds a concurrent honorary appointment as a consultant at the Hong Kong Hospital Authority and the Hong Kong U Shenzhen Hospital. He served as Chief of Service for the Department of Family Medicine of Hong Kong U Shenzhen Hospital, as well as the co-director of the Guangdong Provincial Trainer Center for the GPs. So Dr. Wong.
Thank you, Dr. Wong, for your kind introduction. My background is family medicine, as you heard. I think as a family doctor, we have gone a long way from the SARS time, when you met, some of you might remember, doctors closed their surgery, run away, and refused to see patients, etc. To now, I think in the current COVID-19 pandemic, we really have tried to help a lot. As Dr. Zheng mentioned, trying to screen out patients, treat those who have symptoms, and send those in for serious illness to the hospital, reduce the hospital burden. Dr. Chiu also mentioned a lot of difficulties and challenges we faced as family doctors, lack of information, leadership, etc. But he asked a question, what else can be done? Across the border, at that time, I was working at the Hong Kong Zheng Hospital in year 2001. I conducted a study on surveys on GPs in Shenzhen in China. As you read from the news, China's being very organized. GP there's been helping out on social media, education program, sending in, answering virtual consultations, sending in medicines to the people, even food, and looking after chronic disease patients online. And they generally feel, I think one of very few important factors, how prepared they are in dealing with this problem is their anxiety level. So having good information, clear instruction is very important. Having themselves getting protected and also their family protected in order to get themselves ready to do this. Now, Hong Kong is not as organized, but we are now having a great opportunity with the primary care reform and the blueprint, with setting up of district health centers run by the NGOs who can actually connect up with a lot of GPs in the districts and also different NGOs to coordinate all these this work in the future. So I think there is good opportunity we should not miss. Secondly, as a practicing doctor in Hong Kong, not only now, we haven't finished with the pandemic. I'm still seeing patients with COVID-19 every day. People coming in complaining of long COVID, and also the various concerns as a result of their family, travel, all that issues. We're still facing it. So these crises continue to be our everyday life. And my third point I want to make is I also work with Professor Keat on a study. We look at the international data of over 80 million primary care patients in the world. So the issue of the COVID itself actually ripples out. In reproductive care, for example, in a lot of places shown a lot of pap smear screening, vaccinations, HPV vaccinations, all those regarded as no emergency, no essential service has been delayed or stopped. Patients are not coming into the health centers to have those services done. These cannot be replaced by virtual care. And soon, in years to come, we might see these ripples turn into increase in cancer number, or people not coming in for oral contraceptive during this COVID period. And in some places, we see the pregnancy rate goes up. So these ripples, we have to be addressed as well. It's not just treating the pandemic. It might be at the time, but my point is you have to have a system which can cope with all these changes in the years to come. Thank you.
Thank you, Dr. Wong. And last discussion is Dr. Zheng. He is currently the director of the Center of Social and Political Development Studies and Telephone Survey Research Laboratory at the Hong Kong IAPS and the co-convener of Policy Research. He received his PhD from the University of Hong Kong, and his research interests include Hong Kong and Macau social history and social indicators, social and regional integration, migration and ethnicity, and social service and social policies. A good friend of mine, Dr. Zheng. Dr. Tsang.
Thank you, Stephen. And today we have many prominent medical professionals here, and I prepare a PowerPoint because I'm not an expert in this area. So, and my key PowerPoint is on opinion survey. And the theme of, can I have the, yes. The theme of this panel session is public health crisis. Without doubt, I think COVID-19 is a public health crisis. Even the WHO declared it a global public health crisis. On this question, actually, on how to handle public health crisis, we have lots of view from the academic and medical expert. However, the general public views are seldom addressed and discussed. So my concern is if the general public hasn't seen COVID-19 as a crisis, it would have been harder to handle. I think the case of COVID-19 vaccine received lukewarm response at the very beginning is a good illustration. Even the Live Home Safe app, as mentioned by Dr. Zheng, is another example. That means there's a kind of not so good receipt from the public. So not to mention other harder measures such as lockdown or mandatory quarantine measure. So now let me turn to report to you our recent opinion survey on the public view in handling the COVID-19 pandemic. First, the general public was asked to evaluate the government performance in handling the pandemic in the past 3 years. Around a half of our respondents gave the answer of not so good of the government performance in the past 3 years. And if you're looking closer, you can see young and well-educated and non-pro-establishment respondents gave a more critical answer on government performance. Second, when we asked our respondents to evaluate the medical professionals' performance in handling the COVID, they unanimously give their thumbs up. Almost 90% of them answered that the performance of our medical professional is handling the pandemic very good. There is no significant variation among different groups. And when we change our focus to ask our respondents to evaluate their own preventive measure in handling the COVID, you can see the overwhelming majority, over 90%, replied that they have taken sufficient preventive measure to fight against the COVID-19. And the percentage is particularly higher among the older citizens. And then when we asked our respondents to evaluate the common citizens' preventive measure, you can see also a majority of them, over 70%, answered that they had taken sufficient measure to fight this pandemic. And the percentage is significantly higher among middle-aged and better educated. And then when we asked our respondents about their views on the chance of another big wave of COVID breaking out in the coming years, probably this winter. And you can see over 70% of our respondents told us that the chance is small, and higher percentage of middle-aged and better educated respondents thought that the chance is small. And lastly, and interestingly, when we ask our respondent about their confidence in the ability of the Hong Kong medical system to handle another pandemic outbreaks, about 60% told us that they were confident. Cross-stabilization data show that the older in age, lower in education, and pro-establishment political affiliation respondents were more confident in the Hong Kong medical system. So Dr. Zheng, I think is to take into account the public view. And only when we doing so, it can be more sustainable and also more accountable. Yes, thank you.